Jay in Memphis. This is News Channel 3 at 3.
And good afternoon, everyone, and thank you for joining us for 3 at 3. I'm Alex Coleman. Last month, Shelby County Mayor Lee Harris appointed Dr. Bruce Randolph as the Health Department's interim director. Dr. Randolph recently came out of retirement to step in to the new role and brings nearly 40 years of experience to the department. He joins us now to talk more about the state of public health here in Shelby County. The doctor's in the house. Good to have you here. How have you been doing?
Hey, I've been doing fine.
You and I were talking earlier. I know during the pandemic, many of us felt like you were our doctor, kind of leading the way to let us know what's going on. And now you've come out of retirement to lead us again. How important is this role to you?
Very important. It's very, I feel honored that the mayor thought enough of the service that I rendered previously to call me and ask if I would come and fill in as the interim director and health officer after Dr. Taylor resigned to take a position in Baltimore.
So obviously the right person at the right time, once again, being you. I do want to ask you, though, as we transition here, West Nile virus. So we're hearing that again, especially right here in Memphis and Shelby County. How concerned should we be about West Nile?
Well, I mean, it's something that is present and is concerned. I think we have 4 cases now. And I would encourage people to take protective measures, such as, if you're outside, use a covering, clothes,
long sleeves, shirts, things of that nature. What about the use of DEET and things of that nature?
Use DEET as well, will help repel the mosquitoes.
Now, a lot of us like to be outside before dusk, at dawn, at the same time. What should we do?
And then you should try to avoid the times where the mosquitoes are more active, which is at dusk and dawn, right?
So, Dr. Randolph, as I listen to you, what about those high-risk groups? Who are they? Are we talking about older Memphians, older folks here in the area?
So the cases that we've had so far have been people in the older ages.
What are some of the symptoms, though, when it comes to West Nile? Is it easy to know that you might have it, or do you have to go to a doctor, or what?
Well, you may start out, of course, with fever, fatigue, maybe some confusion, to actually severe symptoms that requires hospitalization. So, of course, if you start having any of those symptoms, you want to follow up with your personal physician, the primary care provider, to be checked out.
And I would imagine vector control here in the Shelby County.
We're very active. We've started sending out patrols twice a day. We're spraying mornings and in the afternoon.
Taking care of business for sure, Doctor. Let's talk about something else. You got to keep it safe. Something else that I know you're concerned about, especially in Memphis and Shelby County, when it comes to HIV infections. What's going on there?
Well, unfortunately, we have a situation where now in Shelby County, we're #1 in the nation for the HIV incidence of HIV, rates of HIV infection.
So in this case, though, we're seeing more cases with younger people, are we not?
So it's the younger people, ages 15 through 19 or 15 to 34 accounts for 69% of the cases. So my message to the young folk is to protect yourselves, get tested. We have a testing program, a home testing program, where you can actually go online, 901hiv.com, and order a home testing kit.
You're making it that easy.
And it will be delivered to your house, and you can test yourself. And there's instructions, of course, if you unfortunately found to be positive, to follow up, and how to follow up with us as the health department. But we're trying to encourage people, get tested, know your status, know your partner's status, and still use condoms.
All right. Dr. Randolph, always glad to see you. Love for us to do this again in the future. Please stay in touch.
We'll do.
The doctor is in the house.
Thank you for having me.
We're going to take a short break. More live music coming up in just a moment.